Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Agna Silmi Kamila Azhar. I'm from Blood Bank Teknologi Health Polytechnic of Semarang. Today I will give you some information about hemophilia. This is the information that I will give it to you. The first one is what is hemophilia? The second one is types of hemophilia. And the third one is symptoms of hemophilia, and then causes of hemophilia, diagnosis of hemophilia, and the last one is treatment of hemophilia. What is hemophilia? Hemophilia is usually an inherited bleeding disorder in which that blood does not clot properly. This can lead to spontaneous bleeding as well as bleeding following injuries or surgery. Blood contains many proteins called clotting factors that can help to stop bleeding. People with hemophilia have low levels of either factor VIII or factor IX. The severity of hemophilia that a person has is determined by the amount of factor in the blood. The lower the amount of the factor, the more likely it is the bleeding will occur, which can lead to serious health problems. And next is types of hemophilia. There is some types of hemophilia. The first is hemophilia A, and then hemophilia B, and then hemophilia C. Hemophilia A. This is caused by a lack of the blood clotting factor VIII. About 9 out of 10 people with hemophilia have type A disease. This is also referred to as classic hemophilia or factor VIII deficiency. Hemophilia A is most common. It occurs in about 1 in 5,000 male births. Annually, about 400 babies are born with hemophilia A. And the next is hemophilia B. This is caused by a deficiency of factor IX. This is also called Christmas disease or factor IX deficiency. Hemophilia B occurs in about 1 in 25,000 male births and affects about 3,000 people in the United States. And then the last is hemophilia C. Same doctors use this term to refer to a lack of clotting factor 11. Hemophilia C differs from hemophilia A and B in cause and bleeding tendency. And the next is about symptoms of hemophilia. The symptoms of hemophilia and the age symptoms appear vary depending on the amount of factor VIII as a person's body makes. Infants with this severe form may bleed abnormally from their mouth and develop goose eggs on their heads, collections of blood under the scalp. Other symptoms of the severe form include bleeding without any known cause, or spontaneous bleeding, into the muscles and joints and organs. Children with the moderate form may bruise easily and bleed too much after minor injuries, dental work, or surgery. There is signs and symptoms of spontaneous bleeding include bleeding into the joints. This can cause swelling and pain or tightness in the joints. It often affects the knees, elbows, and ankles. And then bleeding into the skin, which is bruising or muscle on soft tissue causing build-up of blood in the area, called a hematoma. And then there's bleeding of the mouth and gums, and bleeding that is hard to stop after losing a tooth, and bleeding after circumcision. Surgery performed on male babies to remove a hood of skin called the foreskin covering the head of the penis. and bleeding after having shots, such as vaccinations, bleeding in the head of an infant after a difficult delivery, blood in the urine or stool, and last is frequent and hard to stop nosebleeds. And the fourth topic is cause of hemophilia. Hemophilia is caused by genetic changes or mutations in the F8 gene. This gene is responsible for making the factor VIII protein, an important protein that helps start the formation of blood clots. Mutations in the F8 gene lead to reduced or absent levels of factor VIII in the blood, making it hard for the body to form blood clots. This change or mutation can prevent the clotting protein from working properly or to be missing altogether. These genes are located on the X chromosomes. Males have one X and one Y chromosome, XY, and females have two X chromosomes, XX. Males inherit the X chromosome from their mothers and the Y chromosome from their fathers. Females inherit one X chromosome from each parent. And the next is diagnosis of hemophilia. For people with a family history of hemophilia, it's possible to determine during pregnancy if the fetus is affected by hemophilia. However, the testing poses some risks to the fetus. Discuss the benefits and risks of testing with your doctor. In children and adults, a blood test can reveal clotting factor deficiency. Depending on the severity of the deficiency, hemophilia symptoms can first arise at various ages. In the last topic, it is about treatment of hemophilia. Several different types of clotting factors are associated with different varieties of hemophilia. The main treatment of severe hemophilia involves receiving replacement of the specific clotting factor that you need through a tube placed in a vein. There's other therapies may include desmopressin. In some forms of mild hemophilia, this hormone can stimulate your body to release more clotting factor. It can be injected slowly into a vein or provided as a nasal spray. And then there's clot-preserving medications. These medications help prevent clots from breaking down. And then fibrin sealants. These medications can be applied directly to wound sites to promote clotting and healing. Fibrin sealants are especially useful in dental therapy. Psychotherapy, it can ease signs and symptoms if internal bleeding has damaged your joints. If internal bleeding has caused severe damage, you may need surgery. And then there's first aid for minor cuts. Using pressure and a bandage will generally take care of the bleeding. For small areas of bleeding beneath the skin, use an ice pack. Ice pops can be used to slow down minor bleeding in the mouth. Vaccinations. Although blood products are screened, it's still possible for people who rely on them to contract disease. If you have hemophilia, consider receiving immunizations against hepatitis A and B. There's some information of hemophilia from me. Thanks. Wassalamualaikum warahmatullahi wabarakatuh.